If you're just joining us, some breaking news regarding the campaign of Vermont Senator Bernie Sanders. The campaign saying that he's now been treated for some sort of chest pains, heart condition. It's hard to know how serious this is, but he is hospitalized. His schedule has been cleared. 2 stents have been put in, and I'm joined on the phone now by Dr. Jen Ashton, the ABC News medical correspondent. Dr. Ashton, thanks for joining us. Give us a sense of your read of this statement from the campaign. Does this mean that Bernie Sanders has had a heart attack?
Well, I mean, first of all, that would be speculation right now for any physician to comment on that. Here's what we can tell you about emergency stent placement. First, we have to understand and remember what kind of numbers we're talking about. Heart disease, the #1 killer of men and women in this country. When someone has chest pain or any number of symptoms that could be associated with a heart attack, absolutely the standard of care, everyone needs to know this, is to seek emergency medical attention, call 911, or present to an emergency room. At that point, an EKG of the heart will be done, and based on those EKG findings, it is not uncommon for a patient to be brought to the cath lab where those coronary arteries are then explored. If a blockage is found, it is absolutely an indication for stent placement, and a stent is basically just kind of an opening of that artery. The setting of an acute heart attack is one of several indications for stent placement. There are others, such as unstable angina or even stable angina, but in an abrupt kind of circumstance like this, obviously an acute heart attack is one item on what we call the differential.
But as you said at the top, certainly we don't know enough information yet whether that was the case here, which is a good reminder. But how do you gauge how serious this is? We do hear a lot about stents being put in patients, as you said, when they are found to have some of these symptoms. Bernie Sanders, we know his physician just a few years ago put out a statement that he had no history of heart disease, no history of high blood pressure, only was treated for some mild high cholesterol. But this will take him off the trail, right, for some time. You can't be very active after you've had this procedure.
Well, listen, just from a medical standpoint, I think it's important to remember that, the statistics, again, every 40 seconds in the United States, someone has a heart attack, and the average age of a heart attack for men is 65. It can and does occur in the setting of someone who has, quote unquote, a clean bill of health. Of course, that's less likely than someone who has high cholesterol or high blood pressure or diabetes, but age is a major risk factor, and the appropriate medical action needs to be taken in terms of whether it's stent or bypass surgery or medical management. That is a very complex individual case-by-case decision, but a setting to place a stent is usually made with cardiologists and cardiac surgeons together, along with the patient, and to decide what is appropriate for that patient at that time.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.